everyone, welcome back to my channel. So today I wanted to talk about menstrual cycles and chronic illness. So if this is something that makes you uncomfortable, I would suggest not watching the video, but I'm actually surprised that I have not made this video because chronic illness can do a number on the female body. And so I felt that it was about time to do this. I mean, I obviously probably hesitated to make this video because it is sort of of a more personal nature, but I kind of feel like I'm in a place where I can confidently make this video because I know so much more now about the role that my chronic condition and inflammation has been playing when it comes to my menstrual cycles. So as you already know from some of my previous videos, I have been on IVIG for about 3 years and change at this point. IVIG is a drug that is used for immune deficiencies, autoimmune illnesses, but it also is a powerful anti-inflammatory drug. So it can reduce inflammation really well. And so at this point, 3 years, into this treatment, I have seen changes when it comes to my menstrual cycle. And so those changes that I have seen were more than likely due to a reduction in inflammation. So I know now, based on the things that have improved, what role my illness was playing in my menstrual cycles. So obviously, the very first and very obvious issue that many of us have is irregularity. Skipping periods, having double periods within a month, spotting between periods, things like that. And that was, I actually was never regular my entire life. I was never regular until I started IVIG. I never had, I could never tell when I was going to start my period until I had been on IVIG for the first time many years ago. I went on IVIG, and it seems like from that point on, I became a lot more regular. So that's weird. I could have been having some kind of underlying issue this whole time, even since I was younger, and just didn't realize it until I started IVIG. So, irregularity is happens in people that aren't chronically ill as well. If you're going through any kind of medical treatment, when I did 6 months of antibiotics, I stopped having a period altogether. So for the entire 6 months, I think it was a little bit over 6 months, I just stopped having a period. So, the body has a weird way of doing things, of managing stress and managing, whatever is going on in it. And menstrual cycles are always kind of a telltale sign for women. And for me, having an infection, my menstrual cycle will always tell me when I have some kind of an infection. I will always become irregular. I will always start spotting, or I'll start my period too early, or I'll have a double period. And when that happens, I know that there's something going on. And sure enough, I'll have blood work done, and I show that I have an elevated, I think it's called a SED rate, an SED rate. And that's usually a sign of a acute infection. And I mean, it's almost like, a telltale sign at this point. If I have some kind of menstrual irregularity, I have some kind of infection, an intestinal infection, something's going on. Even I think I had a flu for the first time in forever this past December. And I believe right after I think I had 2 periods, literally like a week apart. And it was like almost 2 normal periods, which is really scary for a person my weight to be, to have that going on. So that it's always like what do they say, the canary in the coal mine. When you see something happening there, then something's up in the rest of your body. And of course, IVIG has helped this situation, because IVIG also helps you manage infection in your body. And so obviously I'm more regular because I have less infections and that kind of thing. So there's not a lot to disrupt my monthly cycles. I also have recurrent vaginal infections, and which is, again, this is sort of a weird, dynamic, because infections will make me irregular, but then my period can also cause recurrent infections. So I get like BV, I will get yeast infections, and it's this past year has been happening a lot. Basically every month that I have a period, it has been happening, and that's one of the reasons why I've been seeking other types of treatment, because it doesn't seem like the IVIG is stopping those types of infections for whatever reason. I don't know if it's just because it's kind of, I don't want to say it's outside of the body, but it's not internal, if that makes sense. But I feel like those types of infections are different than, say, having a viral infection or, some kind of a blood-borne bacterial infection. And so I've been having that recurrent issue, and that was something that I never had before. Prior to having a chronic condition, I never had those types of infections so frequently. I don't really even remember having those infections at all. So the other thing also on the other side of that is sometimes I feel like I have an infection and I don't. So I will experience burning, sometimes maybe some itching, discomfort, irritation in the skin around that area, and there's nothing. I actually went to the doctors a couple days ago, and I told her, I said, I think I have another infection. And she did an examination. She's like, I don't think you do. She says, you're not showing any of the other signs of infection. She said, it could just be hormonal. And again, I don't really experience that, or never experienced that prior to becoming chronically ill. So I imagine that's a chronic illness situation, because just having this random irritation for just, it seems like for no reason. I guess just hormonal issues. So that's been a bit unsettling, and that's kind of a newer development. One of the probably most annoying problems that I know for sure is related to my chronic condition or to the level of inflammation in my body is having this really extended PMS. And if you have PMS or have ever had PMS, you know that it is absolute misery in the days leading up to your actual period. But I would have PMS symptoms up to 10 days that I can remember, up to 10 days prior. I'm talking about mild cramping 10 days prior to actually starting my period. And of course, everything else, irritability, fatigue, joint pain, things like that. 10 days. So 10 days plus another 7 days, you're talking about like over half of the month, feeling like absolute garbage. And I do feel that since being on my IVIG, that time frame has shortened. It can still be like 5 days before, but 10 days is just absolutely absurd. You're spending, almost an entire, over half of the month just experiencing all of these symptoms that are already unpleasant enough during the time of, your period. So that's, an absolute nightmare. And to go along with that, having severe cramps during your period. And I know there's a lot of women that experience this that are not chronically ill, but in my case, I know for sure at this point that the severe blackout level cramping is due to my chronic condition. It took several years. Typically during the first year of my IVIG, I improve. The pain improves enough that I can tell a difference. But last year, was my third year on it, and I noticed a significant improvement in the cramping and that pain that was just so unbearable. I mean, I couldn't go anywhere. I had to be at home. I have to be near a bottle of Advil. I'm taking about 400 milligrams of ibuprofen every 3 hours on the hour through the night for almost the first 48 hours. And still it like blunts the pain. It doesn't stop it completely. And last year, the last 6 months of 2021, I was not taking that much medication. I still had to take medication on the first day. I had to take Advil. I wasn't taking anywhere near as much. I was probably taking half of what I used to take. It was just, to me, it was like miraculous because that had not, I had not experienced that in such a long time. And before I became chronically ill, like when I was a teenager and that kind of thing, I didn't experience cramps at all. So I don't know if my body would have stayed like that had I not gotten sick. But I was not familiar with that severe level of pain. And I know that there are other women that do experience that. I knew from, having friends and talking to other women that was a real thing. I had just never experienced it myself until I became ill. And obviously, with all of that, my own chronic illness symptoms get worse. My pelvic pain, my pelvic muscle stiffness gets worse, obviously, because that's the location that is being affected. But my light sensitivity also gets worse. Obviously, fatigue, acne, all those other things get worse, but my light sensitivity is one of those things that is pretty disabling as it is. And to have it get worse, during that time of the month, every single month is just, absolutely, it's horrible because then I can't really even use my phone. And I mean, I can't watch TV anyways, but I'm limited in using my phone. And, just kind of have to protect myself a little bit more. I mean, I have noticed that seems to have stabilized a bit since I've been on my IVIG. I'm not getting that severe level of light sensitivity during my period every single month. It still does occur, just not all the time. One of the things in the last couple of years, I developed histamine issues. So I developed like sort of a subset of symptoms related to histamine, basically like hair loss, kind of like a burning or weird sensation in my eyes, increased skin sensitivity to like products that I put on my face, increased stomach issues and food sensitivities, that kind of thing. One thing that I've noticed is that my period started to like exacerbate that. So every month I would start to see like a little bit of increase in hair loss. My skin would get a little bit more sensitive. I would start having maybe like a headache or something like that, which I know is related to some kind of histamine situation. So I would see those symptoms kind of get a little bit worse around that time of the month and then taper off and come back down to my baseline after everything passed. And that, that leads me to this other thing that I noticed prior to my IVIG is that my period could be so aggressive and so, I don't know, it just affected my body so severely that I felt that I would lose progress. Like I would feel like I was doing better, or I was like my symptoms were sort of stabilizing and my period would just set me back. It was like one step forward, two steps back every single month. And that was just something that, I would go to the doctor, and I would tell her, it's like, should I just stop having periods? Because it seems like this is having a much bigger impact on me than almost anything else. It seems like just when I feel like I'm starting to stabilize or feel a little bit better, this thing comes and just drags me back down. And, we did discuss that and she said, it's just not a good idea to mess with anything that's going on in your body right now. Just leave it alone. And, it is what it is, I guess. And then of course the IVIG has helped a lot in that department because it's helped to bring down the pain, which pain can also suppress your immune function and mess with your body. And so just bringing that pain down has been a tremendous help, as well as just helping with histamine and a lot of other symptoms. And I've noticed that within the last 3 years that I've been on IVIG. So I don't feel like my period is having that impact where it's dragging me down so much. It can still set me back a little bit. It sometimes still feels like it sets me back a certain amount, but I feel like I bounce back a lot better having IVIG, on my side. Night sweats and insomnia were two new things that I had never experienced with PMS or with my monthly cycles. It is an absolute guarantee that I will have insomnia with my monthly cycles and these horrible, nasty, drenching night sweats. And when I mean drenched, I mean absolutely drenched. I know that there are women who are going through menopause that have hot flashes and that sweat, insanely. I am not familiar with night sweats related to PMS. And let me tell you, it is really something else. And I actually didn't start experiencing this. I mean, I've been sick for 15 years. I've been disabled for like 10 years. I don't think I started experiencing the night sweats until like maybe 5 years ago. So I was well into chronic illness when I started having these. And it is literally, you wake up in the middle of the night soaking wet to the point where you have to change your clothes. And it only happens in the days leading up to my cycle. It was something that I was just like, I don't know what this is. It was crazy. I had heard about, hot flashes and night sweats before. I did not think it was like literally getting soaking wet. And that has actually improved with the IVIG. It actually got to the point where I didn't have them sometimes, or where it was just very, very light sweating. But I mean, it's astounding the amount of things that happen to you because of your chronic illness. And I'm not mentioning any things like, oh, I have cravings or I have mood swings or, I'm tired. Those things are usual, those things are common with PMS. I'm mentioning things that I am pretty sure are related to my chronic condition because I did not have these prior to being sick. And once I started my IVIG, they seem to have improved significantly, almost to the point where they've resolved. So that's how I know that these things are related to my chronic condition. I also have like leg and like knee pain, groin pain. I don't know if that is a common symptom of PMS. I don't remember having that in the past. I actually don't have joint pain as one of my symptoms with my condition. I've never really, I mean, I know my joints are very weak. I know that if I stray from my diet, some things can cause me to have like a little bit of joint pain. But to say I just have random joint pain for whatever reason, I typically don't. And I will notice with PMS and days leading up to it, I do seem to have more pain sort of in the joints by the groin, the knees, and then just kind of like a fatigue of my legs. My legs specifically, not my arms or anything like that. Like my legs will feel heavy and tired. Almost like the muscles are just fatigued, and I will have maybe a little bit of knee pain, joint pain in that area. I don't remember having it any like recently. I don't recall that. I do still get kind of like the leg tiredness, but to say that I have like knee pain and that whole thing, not really significantly. It's probably improved because of the IVIG. So those are just a few of the ones that my symptoms that I have noticed that, sort of came on with my chronic illness and have seemed to have improved with my IVIG. Other things like moodiness, depression, even like anxiety, ruminations, that kind of thing. I haven't really noticed a huge change in that. I do think they are related to my chronic illness and to inflammation, but I have not seen a huge change. They actually seem to have gotten worse, probably because of stress. But these other things, it seems almost like the things that are confined to my body, to my physical body, not like my mental, like my brain. The things that are confined to my physical body are the things that are affected the most by these hormonal fluctuations. So, that's one thing that I've noticed has improved with the IVIG treatment. And I'm hoping I'll see, more improvement as time goes on. Leave me some of your symptoms in the comments, for those of you that have noticed changes in menstruation and that kind of thing. I know that there's some people that have actually just stopped, having periods since they've become sick or because they've lost so much weight. But leave me some of your, weird things that have happened to you and that have changed. And if any of those things have improved with treatment or have gotten worse, please like and subscribe, and I will see you in the next one. Take care.